Thank you. Thank you for the kind introduction and for the invitation to be with you. I have been given a very long title about the NAFLD-Patient guidelines, so let's get started straight away. Now, why NAFLD-Patient guidelines? Why patient guidelines? We have very few examples of patient guidelines in the liver space. The most important example is the one from the PBC Foundation, so from patients living with primary biliary cholangitis. And what you can find in the first paragraph of that document is that they clearly state, okay, you have the guideline by the scientific society, which is there to help clinicians for the diagnosis and the management of their patients. But the PBC Foundation felt that it was crucial that also patients were aware of that guidelines, the content of that guidelines, and how these guidelines could be useful to optimize their management. So it's mainly about what was said also in the title of the document, a kind of lay translation starting from the guideline by the scientific society. We did it a little bit differently for the NAFLD-Patient guideline, as you will see. Now, why patient guidelines? Well, there are four main reasons for it. First of all, it's about empowerment. Empowerment is, of course, important for every patient in every disease, but in particular for this disease, so closely correlated to lifestyle, and in which lifestyle changes are so important for the management, that empowerment of patients is crucial. Another aspect is advocacy. There is almost no specific policy, healthcare policy around NAFLD, and it's urgently needed. There's a problem of awareness. There's a lack of awareness amongst healthcare providers, first line, second line, third line, but also amongst policymakers and in society, and also especially in patients at risks. And finally, there's a need for harmonization. There's a lot of information out there, but it's sometimes discordant. It's not always backed by science. So there's really need for harmonized information about the disease. So that's why we produced in the end the NAFLD guideline. You can see the front page here. It was published in September last year. What is important, and I have copy-pasted here the first paragraph of the document, is the purpose of this guideline. First of all, of course, it starts from the consideration that NAFLD is a serious condition, and that it's important for you as a patient to develop a full understanding of this serious condition. And why is that important, and why can that guideline be helpful? Well, first of all, if you have a good understanding of the condition, you can play an active role in your own healthcare management. Second, you will better understand everything that is discussed with you by the healthcare providers. And finally, it will also enable you to monitor yourself the evolution of your condition and the result of the management that is implemented. Now, it was a long journey. We started in April 2019 at the International Liver Congress with, first of all, launching the idea. And then the first step was, of course, to compose the writing group. And the basic idea was that we needed a multidisciplinary and multi-stakeholder group. And the list of authors is here for you, but that's not the important thing. The important thing is that you see here physicians, hepatologists, endocrinologists, physicians specialized in the treatment of obesity, but also people that are experienced in nutrition, in physical activity, and also patients and patient representatives. And what is also important is that when this writing group came up with the draft of the document, that document was sent to several patients groups outside the writing group to have their comments and input. People from the coalition living with obesity, of people living with obesity in Europe, German patients, Italian patients, and so on. So really the guideline has been developed by patients, patient representatives, clinicians, and scientists. The approach was also a little bit different because we had, of course, the science of the scientific document, but we started in another way. We really started by thinking what should be in that document, what should be the content, what are the topics to discuss. So we made a kind of outline of the document and the chapters, And then we allocated chapters to smaller writing groups. And these smaller writing groups then came up with a document for their chapter that was then compiled in one document. And that first single document was only produced in November 2020, which means about a year and a half after the idea was launched. Why? Because we needed really to go through different rounds of discussion, also several meetings online to discuss issues that still needed some discussion to find a consensus. That was so for the smaller chapters, but that was also for the whole document and also for the list of illustrations that we developed in parallel. And once we then came up with the final document where the whole writing group agreed upon, it was, as I said, sent to several groups of patients outside the group that composed the document to have their input, their comments, their recommendations. These were then integrated. Again, the document was sent through several rounds to the group to have everybody's approval and to discuss final points. And then, of course, it was sent to a professional writer and designer to have the final document that, as I said, was published in September 2021 and is available online for you to read. Here you see just a few pages out of that document just to illustrate you how it looks like, and also to tell you that it's a very large document containing a lot of information. Now, what is still important is it's a guideline. So it's something that should support you in making informed decisions, but it's not there to replace your individual consultation with the people that help you with your medical management, so your medical care team. As I said, it's a very large document. We are now working on a short version. You see here a draft of the front page, 14 important points for people at risk for or living with NAFLD. These cover the different chapters and then refer to the large document for more information, but it's more easily accessible and readable. And we also hope that this will be translated into different languages. For the whole document, that's probably a little bit difficult, but for this short version, this should be perfectly feasible. So with this, I would like to thank once again all the people that have contributed to this document. I would like to thank you for your attention and happy to take your questions.